we live in this scientific era, and I think right now we need science more than ever. But there is a coldness to science, or there should be. Uh, and at the same end, on the other spectrum, there is a lot of human emotions going on that are just as serious and need to be taken seriously. It's just this kind of this crazy time where there's this back and forth paradox in the world that just fascinates me. One of the things we said in a previous podcast, and I want to get maybe you can shed some light a little bit more on this, but we said as chiropractors or PTs or physios, we help people with musculoskeletal pain, and we're in the musculoskeletal business. And I kind of one up that and I said, we're in the trust business. And if you want to translate trust, that's predictability. You know, you telling a patient what sort of outcomes, what to expect with their disc, what other signs and symptoms to look for, how an injury will resolve. And I think about it in a time like this in terms of trust, there's a lot of stability that we take for granted in our lives, I think. And there is just not a lot of predictability, like Bobby was saying with the numbers. I mean, we don't know exactly where this is going to go. What grabs you in this crazy time?
Well, I would touch more on your paradox idea. I mean, there's a paradox between what seems to be bad things and then good things coming out of bad things, right? I mean, there's just this paradox. It seems like you can't find unity sometimes unless you have tragedy. You know, it's like you can't come together until after 9/11 occurs. You know what I mean? You can't come together until a world pandemic breaks out, and then all of a sudden countries are forced to work together and politics stops mattering so much, you know.
Right.
Just this, yeah, the paradox, and you said the word quarantine. It's like this, it's a paradox that actually quarantined individuals can feel more connected with their fellow humans even
Mm-hmm.
though they're in quarantine, because we all have a common goal or destination, which is to get out of this and make it through all this stuff without tons of small businesses going under. I mean, losing a lot of our older loved ones out of this problem, you know. And we should maybe touch base a little bit on this idea of, you know, that doesn't matter for the people that don't think this matters at all. And we already have the flu, which is supposedly kills way more people, so we shouldn't take this seriously. We should probably touch lightly on that. But I mean, yeah, this paradox where we have to come together to protect, you know, the individuals who are compromised through age or through comorbidities or different, you know, health difficulties. um so
Yeah,
yeah, go ahead.
I completely agree that the connectedness of, I think there are, you know, a shocker of all shockers, millennials are getting blamed for certain things right now. And you know, I think you and I are like on the upper limit possibly of being a millennial. I don't necessarily identify, but you know, kids in their 20s and 30s are like, millennials are still going with St. Patrick's Day here the other day, and there were kids out doing stuff. And so they're kind of getting blamed for, you know, perhaps spreading stuff. And it is that kind of awareness that your actions, although it seems like you're in a bubble existentially, we all at times feel alone. But there are times where even if you don't feel affected, and perhaps you are not necessarily having signs and symptoms, like I saw an interview with Donovan Mitchell the other morning, the guard for the Utah Jazz. He's in quarantine. He contracted coronavirus, but he has had no signs, no symptoms at all. But he's quarantined, obviously. Now, if you've got it, you may not even know. You may not be as fortunate as Donovan Mitchell to have gotten testing, or you know, like you said earlier, we don't know those numbers. But just the social responsibility that we all have to each other, regardless of if you feel you do or don't, we are connected. And you know, if you can stop the spread of it, obviously I think that's crucial. It comes down to, like, yes, there's a cold science of dealing with a virus that we don't know about, and it needs to be studied. There needs to be implementation, to a very open and loving way to be like, there are older people who are at far more risk than me, and I need to, I've said this before, subordinate some of the things maybe I want to do just for that older generation. This isn't, I understand there's, evolution in terms of the strong survive, but at the same time, that's the cold science versus you as a loving, caring person need to care about your community and the spread. And I think we all hopefully are realizing we have a much bigger impact than, we may have felt we did previously.